All right, let's discuss why your knee is so sore those first few days after your knee replacement. The main reason is just because of the surgical trauma that your knee has just gone through, and your body is working its hardest to help repair and recover from surgery. So here's a little information about why inflammation or swelling is the biggest culprit of pain after your knee replacement, especially in the first days, if not weeks after knee replacement. So when you have any type of trauma to the body, but in this case, let's talk specifically about your knee replacement, your body goes into repair mode. So your skin has been cut open. They've put in new parts to your knee, a new top and a new bottom to the knee joint. So there's injury to the bone, there's injury to the muscles, there's injury to the knee joint capsule and the surrounding tissue. And so all of these areas are now being sending signals to your brain, hey, we need some help here. So this is when your body sends the repair crew or the cleanup crew to help fix all those little micro traumas, meaning little broken blood vessels. If there's stitches or sutures, your body wants to stitch that skin and the covering layers back together again. So it's sending healing and recovery little repair pieces through blood flow into that area to help with your recovery. Now, when it also brings the increased blood flow, that also causes more swelling. So unfortunately, your first day or so after surgery, you might not feel too bad or swollen. But usually by the second and third day, this is when your body hits its maximum swelling response. This inflammatory response is completely natural and is how the body works for any type of injury. So also in this phase, that's when it feels hot, swollen, red. This is just a sign that blood flow has increased to the knee joint. And this is why so many people recommend using ice right after your knee replacement, because it'll cool the knee down, it'll slow the blood flow to the knee joint, and numb the nerves and cause your nerve pain to go down as well. Now, this intensity only lasts for 72 to about a week or so after your surgery. This is because over time, those little repair bits that are working really hard, it's the inflammatory response, it actually starts to work and the repair is happening day in and day out, no matter what you're up to. And so over the course of a week, your body has now laid down those little foundations of repair, and it doesn't need all that extra blood flow to the area because the signals are no longer being sent that there is damage. Now, one other area that a lot of people don't realize is that part of an inflammatory response is to actually make that area hypersensitive. What do I mean by hypersensitive? It means it's more aware of pain. Helpful, right? But this is, again, your body's natural response to injury, mostly because that will help you protect you from damaging the joint by doing too much. Now, with a knee replacement, this was a planned trauma to the knee, but what you need to remember is that it will be hypersensitive to touch, to pressure, to movement, especially in those first few days. So don't panic that it seems that your pain is super intense and you think it's going to be like that forever. Remember, it's part of the healing process, and it's part of your brain and your body's way of protecting that area initially as it sends the repair and the healing to the knee itself. So think of it like a sunburn. Normally, your skin could handle wearing a shirt, carrying a backpack, getting a massage. But if you have damaged your skin by being out in the sun too long, guess what? Wearing a t-shirt, wearing a backpack, or having someone even touch your arm, no good. So it's very similar. It's a hypersensitivity that's short-lived, right? Once you heal after a couple days, you're wearing your shirt again, no problem. It's the same at the knee. So I'm hoping that this gives you a little bit of context so that you do not panic when that knee pain is that intensity of, an 8, 9, 10 out of 10. And you think, oh my God, is it going to be like this forever? Remember, it is not. It will be intense for the first few days, up to the first few weeks. But knowing that inflammation is your main culprit here and hypersensitivity, take action. Work on your swelling relief and your pain relief, and that will help. If you want more information about how to manage your swelling, watch my next video and I'll give you all the info.